Assalamualaikum and good day. My name is Hayanda Tara and in this video, I'm going to demonstrate the 4 physical assessment techniques, which are the inspection, palpation, percussion, and auscultation in situation where you can find the abdominal pain. So the first that we're going to do is we have to sanitize our hands to prevent the microorganisms. So the first is the inspection. It is the visual examination using the sense of sight. So lighting must be sufficient, either natural or artificial light. So this is to conduct the visual examination clearly, to properly examine the view, the sight. So use visual inspection to assess moisture, color, and texture of the surface. So to inspect if there are many abnormalities with the moisture, color, and texture of the body surfaces. So it is also used to assess shape, position, size, color, and symmetry of the body. So this is to determine the symmetry of the body and if there are abnormalities. Olfactory and auditory cues are also noted. So this is to assess the senses of smell and hearing. It is important to have a quiet environment for accurate hearing when using auditory senses during inspection. So this is to assess the auditory senses accurately. So the next is the auscultation. So auscultation is the process of listening to sounds produced within the body. So there are two types of auscultation: the direct auscultation and the indirect auscultation. Direct auscultation performed using the unaided ear, for example, is to listen to our respiratory breaths. So it could be directly on the patient's skin surface. So, the indirect auscultation is performed using a stethoscope. Auscultated sounds are described according to their pitch, intensity, duration, and quality. So, it is used primarily to listen to sounds from within the body. So the next is the percussion. Percussion is the act of striking the body surface to elicit sound that can be heard or vibrations that can be felt, used to determine the size and shape of internal organs by establishing their boundaries. So there are two types of percussion: the direct percussion and the indirect percussion. So it is to indicate whether the tissue is fluid, filled, air-filled, or solid. Direct percussion. Strike area to be percussed directly with the pads of 2 or 3 forefingers or the pad of the middle finger. So strikes are rapid. Movement is from the wrist. So this is to perform immediately. So in the indirect percussion, striking of an object held against the body area to be examined, middle finger or of non-dominant hand is placed firmly on the client's skin. Only the distal phalanx and joint of this finger should be in contact with the skin. Using the tip of the flexed middle finger of the other hand, the nurse strikes the pleximeter. Striking motion comes from the wrist. forearms remain stationary. The angle between the flexor and the fleximeter should be 90 degrees. So blows must be firm, rapid, and short. So this is to obtain a clear sound. So in palpation, it is the examination of the body using the sense of touch. So pads of the fingers are used. So concentration of the nerve endings makes them highly sensitive to tactile discrimination. So the examiner's hand should be clean and warm, and the fingernails should be short. So this is to prevent the spreading of the microbes. So it is used to determine the texture, temperature, vibration, the position, size, consistency, and mobility of the organs and masses, distension, pulsation, and tenderness or pain. So note any abnormalities observed. So there are two types of the palpation. The light palpation, deep palpation. So in the light palpation should always proceed in the deep palpation. So this is a heavy pressure on the fingertips can dull the serve of the touch. Light palpation. The nurse extends the dominant hand's finger parallel onto the skin surface, presses gently while having the hand encircled, skin is slightly depressed, and the nurse pressed lightly times rather than holding the pressure. So this is to determine the details of mass. The dorsum of the hand and fingers are best used to test the skin temperature. Examiner's skin is the thinnest. Palm of the hand is used to test for vibration. It is because the palm of the hand is sensitive. Areas of tenderness should be palpated last. So this is to ensure that the patient will only feel the assessment at the areas of tenderness. So that's all for today's procedure.